Hi, good morning Billy. My name is Salena Midfield. I'm your invigilator for the OET-speaking session on the 23rd of July 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Billy Paulson.
And what is your candidate number, please?
My candidate number is 202892121.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Why did you choose nursing as a career?
There are two things that inspired me to become a nurse. The nurses who cared for my grandfather made such an impression on my family and me that it kind of sealed the deal for me. I realized I wanted to impact others and encourage and lift them up the way those nurses did for my family. Secondly, I have always wanted a career that offers long-term employment and financial stability, and the opportunity to give back to others without limiting my ability to care for my family. I feel like nursing can give me the best of both.
In your opinion, how important is open communication between team members?
I believe open communication is crucial for team members, no matter what profession one chooses. Effective communication is one of the most essential skills nurses must develop. It is important for nurses to learn to appreciate and value how effective communication can set the tone for therapeutic nurse-patient relationships and solid interpersonal relationships. As a nurse, I understand how I should communicate with peers and patients could significantly impact how our team functions and how well patients respond to our care.
What are some negative effects experienced by nurses required to work long hours, such as 12 to 18-hour shifts?
Some negative effects of long work hours are fatigue, stress, and anxiety. I think that's true of any job or situation that requires a lot of time and effort. I try to combat the negative effects of stress both personally and professionally by practicing self-care and relaxation techniques. I also try to spend time with friends and loved ones outside work, so I can have a healthy work-life balance.
Tell me some responsibilities you believe are part of the nurse's role.
I think the nurse's role is certainly multidimensional. Aside from performing assessments and giving medications and treatments, I believe nurses play an essential role in promoting good relationships between patients and their healthcare teams. I also feel that if we use the right platforms, nurses can be instrumental in initiating and supporting measures to promote the profession for the good of patients, nurses, and all healthcare professionals.
What do you imagine is the most difficult thing about being a nurse?
I am sure there are many difficult things nurses face. I think one of the most difficult things about being a nurse is knowing you have done all you can for a patient and facing the fact that the only thing left to do is make them comfortable.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning, Selena. Good to see you again. I am your attending nurse, Billy Paulson here. How are you doing?
Good morning, Billy. I am doing well. Thank you for asking.
Happy to hear that. Well, Selena, can I confirm that you are here attending the appointment to get information on pneumococcal polysaccharide vaccination, also called PPV?
Yes, nurse. I am here because the clinic has sent me a letter to say that I had to have the vaccination.
Yes, Selena, that is right.
Well, nurse, I don't think I need to have it.
I acknowledge your words, Selena. I can explain to you why you have received the appointment for PPV.
Yes, I would like to know about it.
Sure, Selena, you received the letter, as you are having type 1 diabetes mellitus.
But nurse, I have already received the annual flu jab, and it is enough. I don't need any more vaccinations.
Your concern is quite natural, Selena. Can I clarify it for you?
Okay.
The PPV is just for pneumococcal bacterial infection. It doesn't act on any other infections. Since the infection-causing bacteria remain constant, PPV is given every 3 years. Perhaps, the flu vaccination you are receiving annually is for viral infections. The point to be noticed is that, here the flu strain constantly changes, which makes it essential to be given yearly. I hope it is clear to you.
Okay, nurse. I understand that. But, I don't wish to take the vaccination.
I respect your words. Selena, may I know the reason why you do not wish to take the vaccination?
After the flu vaccination, I felt very feverish and tired. Moreover, I was not even able to move my arm after the flu vaccination. I do not want to be sick anymore.
I am sorry to hear that. However, I would like to inform you that these side effects are quite common to occur after the flu vaccination.
Let it be. Now, is there any chance that I am likely to feel unwell after this vaccination?
Your thoughts are quite reasonable. For your better understanding, there will be some after effects of every vaccination.
I would like to hear about the side effects of PPV.
Selena, there will not be any serious side effects. Sometimes, you may experience a slight temperature after the vaccination. In addition, redness or swelling at the injection site is normal after taking PPV.
This is the reason why I said no to having PPV.
Selena, these side effects can be managed easily. In case you feel unwell after the vaccination, I recommend you make an appointment with your GP.
I am still not fully recovered from the flu vaccination side effects. I don't need PPV. I will take care of it.
Please let me know if the side effects are your only concern.
Yes, nurse, I had my annual flu vaccination just 2 weeks ago, and I was very sick afterwards.
Well, Selena, let me clarify your concern. Like the reaction to the annual flu vaccination, PPV will not be having such higher side effects. I can also assure you that you will be provided with medications like paracetamol and acetaminophen.
No, nurse, I don't wish to take PPV.
Type 1 diabetes mellitus patients are at higher risk of pneumococcal infections, which can cause several complications.
What is it?
Yes, Selena, it is. The infection can range from ear and sinus infections to pneumonia and septicemia, which is an infection through the bloodstream, thus making it far more severe, and even affecting the heart and kidney functions adversely, and alarming the life-threatening situation.
Oh, I see.
Selena, I reassure you that the side effects can be managed much effectively. Don't be overly concerned about it.
Okay, nurse.
I hope you understand the risk involved. So, now are you willing to take the vaccination?
Yes, nurse. I am willing to take the vaccination.
Glad to hear that, Selena. I can reassure you that it is completely safe to have the PPV.
All right, I now realize that.
Thank you for your understanding. Can I get your consent for the PPV?
Sure, nurse. You may please proceed with the vaccination.
Thank you for your consent, Selena. I really appreciate your decision.
Thank you. That is the end of your OET-speaking role play. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.